Hi, I'm Dr. Andrew Plummer. Welcome to Spark Eye Care. This video is going to help you navigate the process of cataract surgery. This is part of a series of videos on cataract surgery, which you can find on our YouTube channel. At this point, hopefully you've had your clinic evaluation, so let's focus on getting ready for surgery. A lot of patients ask me about some other surgical options and technologies, so I want to take a minute to review those here. A question that I often get is, what if I don't like the lens that I chose? It is possible to go back to the operating room to swap out the lens, but this is not something that we want to do routinely because there is risk involved. It's better to get it right the first time, which is why we put so much effort before your surgery to make sure everything is perfect. Another question I'm often asked is, what about laser cataract surgery? This is commonly referred to as blade-free cataract surgery. I've performed thousands of laser cataract surgeries in the past, and I hate to say it, but the outcomes were just the same as non-laser surgery. There's even good research evidence now that says patients see just as well and have the same complication rate whether or not they got laser surgery. My feeling is that the laser costs patients more money but doesn't provide enough value, so I don't currently offer it. Of course, as technology evolves, this might change, but I always fall back on asking myself, what would I do for my own parents? If I wouldn't use the laser for their surgery, how could I feel comfortable charging patients for it? Now, let's spend some time talking about those complications I mentioned. Overall, cataract surgery is very safe. In my hands, patients have about a 99.5% chance of a successful surgery, meaning better vision with no complications. However, all surgeries involve risk. For cataract surgery, we can divide those risks into things that are minor and brief versus complications that are more rare but have a more serious or permanent effect on your vision. The worst thing that can happen with cataract surgery would be things like infections or retina detachments. Now, these can be devastating, but fortunately, they are very rare. The rate of infection is somewhere around 1 in 5,000 cases, and for retina detachments, it's certainly less than 1%, probably closer to 1 in 1,000. These are serious complications, and early detection and intervention are very critical. So please call me or call the office if you have lots of pain or decreased vision or any other issues after your surgery. Much more commonly, patients can experience minor issues that delay their healing and recovery, but don't ultimately affect their outcome. These are things like swelling in the front or back of the eye, inflammation that takes longer than normal to go away, or dry eye after surgery. These can usually be managed with extra eye drops or extra time. Probably the most common issue right after surgery is increased eye pressure. There's this pressure spike that happens after surgery, and it usually resolves on its own within 48 hours. If the pressure is too high on your first day post-op check, I'll usually give you an extra eye drop or I'll adjust the pressure in the clinic. This rarely causes any long-term problems, even for patients who have glaucoma. Another common issue that happens after surgery is scar tissue. As part of the healing process, some patients will develop a sheet-like layer of scar tissue behind their lens implant called PCO. This usually happens a few months after surgery and can be easily fixed in the office. We use a non-invasive laser to remove the scar tissue, and in just 30 seconds, it's gone forever. Now that we've gone over the risks, let's talk about what to expect on your surgery day. You'll get your surgery date from our office, but usually the surgery center will call you to tell you when to arrive for your surgery. Sometimes they may make this call the evening before surgery, so don't panic if you haven't heard from them. They'll ask you not to eat or drink anything after midnight before your surgery date. But you can take your normal medications that morning with a small sip of water. Please do not eat or drink before your surgery because the anesthesia staff may have to cancel your surgery even if you've had something like coffee. You also must have someone to drive you to and from the surgery center. You do not need to stop blood thinners if you take them, and please don't wear eye makeup on the day of your surgery. Once you arrive, you'll be taken back to the pre-op area where a team of nurses will have you change into a gown. They'll put in lots of dilating eye drops and they'll start an IV so that you can get some relaxing medicine. We'll have you sign lots of forms, and I'll come chat with you before you roll back to the operating room to make sure that we confirm our surgical plan and answer any last minute questions. In the OR, we want you to be as comfortable as possible. You'll be lying flat on the operating table, but we'll give you a blanket and a pillow under your legs to help your back. My job is much easier if you're relaxed and comfortable, so please tell us if we need to adjust anything. In the room, there will be lots of bright lights and you'll hear lots of noises from our machine. A nurse will clean your eye with an iodine solution and will cover you with sticky drapes to keep things nice and sterile. At this point, we don't want you to reach up or touch anything so that we don't contaminate our sterile field. So ask for help if your nose itches or you have other problems. To start the surgery, we'll do a checklist to make sure that we have the correct patient, the correct eye, and the correct lens implant. Then I'll bring over my microscope, which will shine a very bright light on your eye. At this point, your eye will be numb and you'll have some relaxing medicine through your IV. Our goal is not to put you to sleep or even make you drowsy. We just want to give you enough medicine so that you don't feel too anxious or nervous. I also don't want you to feel any pain during your surgery, but it is common to feel cold fluid and pressure as I take out that cataract. Strange noises from our machine are also completely normal, and they help me control what's happening inside your eye. The whole surgery lasts about 10 minutes. A lot of people worry about blinking or moving during the surgery, but we place an eyelid holder and I use special techniques to keep everything nice and steady, so it's usually not a problem. If you do need to cough or sneeze or move suddenly, give me a little verbal warning and I can safely get out of your eye to give you a chance to do whatever you need to do. The last thing we do is pull off those sticky drapes, which some patients say is the worst part of the whole surgery. After that, we put a plastic shield over your eye and take you out to the recovery area. Most patients are heading home just 15 minutes later, but overall, you should expect to be at the surgery center for about 2 hours. While you're at home recovering, I want you to wear that protective shield for the first day. You can remove it to put in your eye drops, but otherwise leave it taped in place. Your vision will be blurry, but some patients say they can see improvement within hours of surgery. Blurry, scratchy, and sore are all normal, but most patients are seeing and feeling fairly well within a day or two. We'll have you come to the clinic the next day to check everything out. If you feel like you can see well enough and you feel comfortable, it's okay to drive yourself to that appointment. But remember, you can't drive yourself on the actual day of surgery. In the clinic, we'll take off that shield and check your vision and your eye pressure. I'll look to make sure that everything is healing well and answer any questions you might have. This is often the very best part of my job because I get to share in your joy at having better vision. At this point, we'll review your post-op instructions, which I'll cover in another video on our YouTube channel. Remember that it's totally normal to feel anxious going into cataract surgery, but hopefully this video has given you a better idea of what to expect. No matter what, I want you to know that I'm here for you and I'm going to take really good care of you. Thanks for watching.